I'm Lindsay Hall, and this is the solution to less medical errors. America is falling victim every day to the injuries and deaths caused by medical professionals. Medical errors are the errors caused by medical professionals that cause harm, injury, or even the death of a patient. Malpractice, negligence, and overworked professionals are causing the number of medical errors to skyrocket in America's healthcare system. With the implementation of two systems in the medical facilities of the U.S., the number of such adverse events can be dramatically decreased. Medical errors can be categorized into two groups: error of commission or errors of omission. Errors of commission are where we choose to do something, we acted, and we were wrong. And errors of omission are the mistakes where we failed to act when we should have. According to a report published by the United States Institute of Medicine, it is estimated that between 44,000 and 98,000 people are killed each year by way of medical errors in the United States alone. And according to Daniel and McCary, there are over 251,454 deaths each year. This number would place medical errors as the third leading cause of death in the U.S., just beneath heart disease and cancer. See the image to your right. Despite the fluctuation in the data, it is still evident that this is a major issue in America's healthcare system. There has been no record of any large-scale solutions that will resolve the whole problem, but in localized areas, precautions have been implemented to minimize the number of deaths. The American Society of Health System Pharmacists released a guide that states obtaining a medication history and performing medication reconciliation on admission are crucial, and it is recommended that pharmacy be involved in obtaining an accurate medication history. This statement shows the importance of obtaining the appropriate and correct patient history to prevent medication errors. They have put these guidelines in place to improve patient safety and limit the number of medical errors. Where they have failed is where overworked professionals try to save time by cutting corners and causing mistakes to be made. In other areas of the nation, they have implemented technology to reduce medical errors. This, as it is stated here, hospitals have implemented automatic dispensing systems and barcode technology to decrease and keep an accurate inventory of drugs on the unit. You can see the top to see a picture of one of the automated supply systems. Barcoded medication administration systems have been linked to a reduction in medication error to 54 to 87%. This is a great solution and can only improve by expanding to include technology in other hospitals in the United States. The number of patients' deaths due to medical error can be dramatically reduced if America's healthcare system would implement the solution of a universal electronic system for patient records and a standardized system for surveying and reporting. The universal electronic system for patient records will work as a nationwide system that will house complete medical records and histories of all American citizens. This will allow for immediate access of critically important information when it is needed, with one of the largest causes of medical errors being the delay in transfer of patient records and information. A universal system could fill the gap to allow records to be accessed immediately. Annie Carey states, insufficient information flow happens when necessary information does not follow the patient when they are transferred to another facility. This information can be critical to the survival of the patient, and in the case of an emergency, it can prevent a medical error. The standardized system for surveying and reporting will be a nationwide generic form for reviews of medical facilities that will be completed by medical professionals reporting on their coworkers' abilities. With the implementation of this system, it would help aid in public safety and in the internal affairs of the medical facility itself. During a podcast interview with Dr. John James on public safety, Dr. Sweeney states, doctors do know who we would go to and who we wouldn't, who is safe and who is dangerous. This information should be public knowledge, and patients have the right to know if a professional can truly be trusted. After time is allowed for corrections and adjustments to be made, the report should be released to the public. With this knowledge made available to the public, it will assist patients in finding the best recommended physicians. The goal of these small solutions is to incorporate them nationwide and lower America's medical error death statistic. These are very possible to implement, and both will improve statistics, efficiency, and accuracy in the healthcare system. With these steps put together, they will not completely diminish the problem, but they will help minimize the occurrence of the errors. To begin this process of implementing a universal electronic system for patient records, it would require 4 large steps: the building of the system, transferring the records, organizing the information, and then securing the information. The building of the system would take the most time, money, and digital media specialists to work in the system design. It would most likely take more time than any other step, being that they would need to design a large, secure system that could be trusted with confidential information. The next step would be working with each state to transfer all the records for each person into the system. It would be set up within the program to have categories for each state, and the person's records would be then the state that they reside. It would then be organized by pediatric and adult files for each state. Within the file, the full names would appear in alphabetical order, with the last 4 digits of the social would appear next to it to distinguish patients with the same names. The system would then have several security locks and system barriers to protect personal information. The system would have patient access portals so they could access their medical records if they needed to or desired to. The system would make it easier to access patients' information in case of an emergency and allow that person the convenience of sharing records between multiple specialists and other physicians. The system will also prevent records from being lost and keep everything localized in one program to allow fluency and the best monitoring of the patient's health. Dr. James suggested that the survey should be standardized surveyed nationwide to allow consistency. Dr. James stated, if you were to implement this in hospitals where physicians were evaluated by their colleagues, that would be a guide to some of the things that they needed to fix. This survey would be a mandatory biannual event where a generic survey would go out and the professional writing the reviews would remain anonymous. To further improve Dr. James' solution, the results would be distributed following review by facilities management, allowing the professionals to see their areas they need to improve upon. If there is a major problem that could be life-threatening to the professional's patients, then they would be monitored closely. When the results are released to the public, it would also show an update on what the professional did and list the steps that were taken for the betterment of their tactics and care. This will give the public the knowledge of who to trust and who will hold the healthcare providers accountable for their actions. Both solutions can be done and fully implemented within 5 years. It would take time to work out any problems with the systems and to get them both fully running, but it is possible. The universal record system will take money to put together, but there will have to be someone to hire the right people. For the system to be set up, it would be easiest to use the federal government to help be secure and nationwide. It would be funded through a variety of outlets like percents of taxes, both from state and federal, and it could help be funded by insurance companies if the government works with different large companies. The surveying system can just be released through the American Hospital Association to require hospitals to use this generic survey to help to improve their staff's error statistics. There are thousands of U.S. citizens falling victim to the medical errors across the nation. It has been widely dismissed disseminated and has caught the attention of the American public as well as the federal government. These adverse events happen every day and pose a true threat to America's health care system. The United States cannot completely remove this problem, but it can be improved. This affects everyone, and change is needed to improve America's health care system and public safety. Thank you very much.